There's a rather eye-opening study. I came across this the other day and I thought we need to find out more. So the study shows, and it's a fairly large sample here, almost 400,000 people, that older adults who experience loneliness may actually live longer than their peers who are less lonely, which is obviously something that contradicts conventional wisdom on the subject. And it's been that way for a while. So we're going to try to find out more. Dr. John Hirdes is a professor at the University of Waterloo in public health science and is on the line. Doctor, first of all, thank you for your time. Let me go to this. When I said conventional wisdom, all we've been hearing, of course, is just how serious loneliness is. And this study seems to show otherwise. So give us some details here.
Well, thank you for having me. Our study is based on large nationally representative samples from Canada, Finland, and New Zealand, looking at the home care population. My expertise is in long-term care and home care and mental health, and I was particularly interested in home care clients because they are a very vulnerable population. And so I thought, okay, well, if loneliness affects mortality in the general population, like most research is based on, it must have a bigger effect in a vulnerable population like home care clients. In Canada, we have extensive data on home care clients because most provinces and territories in Canada have implemented a standardized assessment instrument that my research team developed. So that's why we have hundreds of thousands of observations linked to mortality. What I expected to find is that after I adjusted for health characteristics like depression and physical health indicators like medical diagnoses, that association might be weakened. But we in fact found a negative association, so lower mortality risk for lonely home care clients compared to not lonely home care clients after we adjusted for those factors. So that was a surprising finding. I didn't expect to see that. And then I spoke to my colleagues in other countries and they said, well, we found the same thing and we didn't expect to see it either. And so now that we have data from 3 countries with the same findings, we're much more confident that this is correct.
So let's clarify here a couple of things. Number one, you're talking specifically with home care. You might have thought, as you just said, that the numbers or the research might show a different result here, but it didn't. What are we attributing this to? Is there one specific factor or many?
There's many factors. First, the literature is not as unequivocal or unambiguous as the popular media reports have suggested. In fact, there's mixed findings in the literature. Some studies find no effect. Some studies find increased effects for mortality, and others find negative effects or protective effects, if you will, as we have. But it's not nearly as strong a finding as popular opinion might suggest. I think partly that's because some of the findings that are that show the increased risk are based on the general population. And if we look at 2 people on the street and one is lonely and the other is not, the lonely person may also have other health conditions, mental health concerns and physical health concerns, and it might be those things that in those other studies increase risk. My sample is based on a more clinically complicated population of people who've got lots of things going on, and in that context, loneliness doesn't seem to have been as important a variable. And in fact, if we think about the home care population, people who live alone and get home care are probably more likely to be lonely. But to live alone and be a home care client, you have to probably be healthier than home care clients who live with family members because they have to get help from family members. So that's why thinking about intervening health factors is so important. And that's what we did in our study that other studies tend not to do.
It's interesting when you say that, right? But you would have thought if you're home or home care recipients, those people would be a particularly vulnerable group, more so than others.
Yeah, so I was expecting to see a bigger effect than in general populations, and in fact, we found a mild protective effect, and it's only about a 10% reduction in mortality risk. And so I think the bigger story here is that we need to emphasize the importance of loneliness in its own rights. So loneliness doesn't have to kill you for us to care about it. Loneliness is a bad thing. It has very negative consequences for mental health, and the mental health consequences of loneliness are the reason we should really care about it. It doesn't matter whether it's associated with mortality or not. The key thing is it's devastating psychologically, And that in itself is a public health concern.
By the way, I will mention one other thing in the story that I thought was worth mentioning when we talk about home care, and I don't want to just focus on that, but that is sort of the focus of what you've been talking about here. But the idea of social intervention, when you're at home and being visited by medical professionals or nurses, that's actually a positive that works against loneliness, it's suggested, right?
Absolutely. Yeah. So if you're a home care client, a case manager will visit you periodically. You'll get some personal support services, and family members come together to provide you a lot of support. So, that's why lonely home care clients are kind of a unique population. They're, in fact, more isolated than other home care clients are. So, if you have cognitive impairment or physical disabilities, or you're at the end of life, family members come together to help you out and you get more services. Now, what we don't know yet, and this is part of our future research, is are lonely home care clients more likely to be admitted to long-term care? We did not test that, so that could be something that happens with them. The other thing is that lonely clients may seek out more medical attention and may get more medical care. They may be getting it because they feel lonely, so they're reaching out to see somebody, and maybe they get better care that way. We haven't tested that hypothesis either. But our central point is that we don't always have to justify a mental health concern as being a physical medical problem in order for that mental health concern to be important. And that's where I think loneliness is in our view.
Two things. Number one, we keep talking about older adults. The loneliness issue right now just seems to be broadly about people in general, younger people, older people as well. This is specifically about older people. It says nothing about other generations.
Right. So we focus on home care clients who are predominantly older adults. There are some younger people with disabilities in home care that we included in our sample, but it's probably about 85% older adults. But I think if we think about younger individuals, again, the mortality risk related to loneliness is not as severe as the mental health risk. So if there's an important issue of loneliness in younger persons, the mortality risk is probably related to self-harm, which is a real thing to be concerned about. And that self-harm is probably a consequence of mental health concerns.
Right.
So that's why I think we need to reframe this entire discussion as a mental health discussion first.
One last question. We mentioned off the top, I said fairly big research, nearly 400,000 people. So Canada, Finland, and New Zealand. I'm just wondering, how did Canada fare comparing to the other countries?
We had lower rates of loneliness than the other countries did, and our risk rates were about the same as the other countries.
All right. So pretty much when you say the lower, but pretty much in the same ballpark, if you will.
Same ballparks.
Okay.
And that's one of the exciting things about this is all three of our research teams thought, oh, we can't publish this because that's not what the popular opinion says. And then we realized we have the same findings. So we've got something here that we need to talk about.
It's a fascinating study, and maybe this comes as good news to people, especially those when you talk about home care, to find out, it's not a death sentence at the end of the day.
Yeah, it's not a death sentence, but it's an important issue the health system has to respond to as a mental health concern.
Absolutely. Want to thank you so much for your time. Very much appreciate it.
Thank you for having me.